Welcome to the Department of Health and Human Services. I'm going to tell you about the variety of insurance programs for employees and their families and provide highlights of the plans. This is one of 3 informational videos to get you started in your employment at DHHS. The other 2 videos are Getting Paid and More Than a Paycheck. The information in this video is intended to help you understand the many choices you have when it comes to insurance for health, dental, vision, life, and long-term disability. You will need to study and compare these choices to make the right decisions for you. Please watch, learn, and jot down questions. More information is available online and from your local DHHS Human Resource Office. Contact information is included in your new hire letter. This presentation provides a brief overview of each plan. To see costs and complete coverage information, you will need to access the State Employee Link, L-I-N-K, website at link.nebraska.gov. This website provides you with easy access to wellness and benefits resources and will assist you in selecting the best insurance coverage for you and your family. Read and understand the information provided about your insurance options before you make a decision. Please feel free to contact the DHHS Payroll and Benefits Office at area code 402-471-9240 with any questions. There are 2 basic requirements that must be met in order for you to enroll in the State of Nebraska Employee Insurance Benefits. First, you must work at least 20 hours per week in order to enroll in and maintain eligibility for insurance. Second, you must enroll for benefits within the first 30 calendar days of employment to have insurance coverage. There is a waiting period for new hire enrollment into our insurance benefits. You must be covered for 30 calendar days before benefits will begin. Coverage starts the first of the following month after that 30 calendar days. If you are hired as a full-time employee, you pay only 21% of the premium cost for your elected health insurance plan. The state pays the remaining 79%. If you are hired as a part-time employee, you pay a little more for your health insurance. The state still pays a portion of the premium cost, but it is on a prorated basis. The new hire benefit enrollment process is completed online in the Employee Work Center. Once you log in, you will see the new hire benefit event in your inbox. This is where you will make your selections and submit the event. Remember, you must enroll within your first 30 calendar days of employment. Insurance benefit plans have a lot of terminology associated with them. There are a few terms you need to know to choose the plans that will meet your needs. The first is premium. This is the amount of money you pay to purchase insurance coverage. Premium costs are listed on the State Employee Wellness and Benefits website. The premium amounts listed are monthly rates, so half of that rate is deducted from your biweekly paychecks. If you are part-time, the listed premium amounts are prorated. A copay is a set amount you pay before a plan pays for specific services. For example, a physician office visit may have a $20 copay. That means you must pay $20 at the time you receive the service from your physician. A deductible is the amount you pay before health care expenses are paid by the plan. Some services are subject to a deductible, and some services are not. Coinsurance is the amount you pay as a portion of a health care expense. This amount is applied to your maximum out-of-pocket expenses. Coinsurance amounts are generally a set percentage of a service, such as 20%, and are applied after the deductible is met. The maximum out-of-pocket is the amount you must pay before a plan pays for all eligible expenses in full. In-network refers to services received by a provider as part of the health insurance provider's network of doctors and hospitals. Out-of-network services are from providers that are not part of the health insurance provider's network. You generally pay higher copays, deductibles, and co-insurance amounts for services received. The IRS Tax Code, Section 125, allows tax sheltering of your premium costs for health, dental, and vision. These amounts are tax sheltered, which reduces your overall tax liability. The tax sheltering occurs automatically through payroll, so you can have a tax savings on each of your biweekly paychecks. These items are taken into consideration when determining the most cost-effective insurance plan for you and your family. Employees and the state of Nebraska do share the costs and the responsibility for health insurance plans. The state of Nebraska health insurance funds are self-insured. A self-insured plan means the premiums paid by the state and its employees, not an insurance company, cover the cost of health care claims. The insurance company used by the state simply administers the plans. Since we are self-insured, the state designs the health insurance plans and determines the copays, deductibles, and premium costs. All premiums go into this health insurance fund, which is used to pay the claims submitted by all covered plan members. Since we all share in the costs, we also share responsibility. The state's responsibility is to offer comprehensive benefits and to provide the tools and resources you need to understand your benefits. Your responsibility is to use the tools and resources provided to understand your benefits and to use those benefits wisely. The Patient Protection and Affordable Care Act, or PPACA, better known as Healthcare Reform, was passed into law in 2010. There are several provisions of this law that apply to our health insurance plans. Some key provisions include: adult children may be covered on a health insurance plan until they turn 26 years of age. Preventive care services are covered at 100% with no copay or co-insurance if within the PPO network. Some preventive services are subject to gender, age, and frequency limits. All health plans are administered by United Healthcare. The four plans are the Wellness Plan, the Regular Plan, the High Deductible Plan, and the Consumer-Focused Health Plan. Please note that the High Deductible Plan will be eliminated effective on June 30, 2015. You may elect it as a new hire now, but you will be required to switch to one of the other three plans during the 2015 open enrollment period. There are similarities between the plans. All plans do use the same network of doctors and hospitals, and all plans do give you access to the employee wellness program known as Wellness Options. There are some differences, however, including the costs of premiums, copays, deductibles, and co-insurance. If you need specific medical services, review each plan carefully to determine which plan covers that service best. Comparison charts are available through the Wellness and Benefits Resources section of the LINK website to help compare and contrast the four available plans. The Wellness Health Insurance Plan is closely tied to our wellness program and is designed to encourage a healthy lifestyle for you and your family. It promotes and covers a variety of preventive care services without gender, age, and frequency limitations. The Wellness Plan also requires you to participate in the wellness program. If your spouse is enrolled in the plan, he or she must also participate. The wellness program has an annual 3-step cycle that you must complete. I'll share those steps with you a little later in the presentation. If you enroll and do not complete the requirements to remain in this plan by the deadline, your enrollment will be switched to the regular plan, and you may be ineligible to enroll in wellness the following year. Employees who select the consumer-focused health plan may choose to enroll in an HSA, or Health Savings Account. An HSA is a personal bank account that you own, and it allows you to save money out of each paycheck on a pre-tax basis. You can use the money in your account to pay for qualified medical, dental, and vision expenses, such as doctor visits, prescriptions, or hospital visits. Or you can save that money for future health care needs. Unlike a flexible spending account, or FSA, the money in your HSA does not have a use it or lose it rule. You can leave the money in there as long as you want and take it with you after you leave employment. You can also grow the money in your account because it is an interest-bearing account. Once you reach a certain account balance, you can invest the money in mutual funds to grow your balance even more. If you choose to enroll in an HSA, you cannot enroll in the Healthcare FSA, explained later in this presentation. There are additional eligibility requirements for the HSA explained in the Options Guide on the LINC website at link.nebraska.gov. The State of Nebraska Employee Wellness Program, or Wellness Options, is participation-based and available to you and your spouse if enrolled in any of the 4 health insurance plans. It offers worksite and web-based education tools, health coaching, lifestyle programs, biometric screenings, online recipes, and a wealth of other health and wellness information. The website is www.wellnessoptions.nebraska.gov. You'll be able to create an online account after you have enrolled in one of the health insurance plans. As previously mentioned, the wellness program has an annual 3-step cycle you must complete if you want to enroll or continue enrollment in the wellness health insurance plan. As a new hire, you and your spouse, if applicable, will be required to complete an online health assessment. That assessment must be completed in your first month of health insurance coverage. If you or your spouse do not complete that, you will be defaulted back to the regular health plan. After that is completed, your requirements for continued eligibility will vary depending on the time of year you are hired. Please see your new employee benefit packet for details. After your new hire eligibility requirements are completed, you will then follow the same annual cycle each year. The wellness plan year begins on April 1st and ends on March 31st of the following year. All requirements must be completed by you and by your spouse if you are covering him or her on your health insurance. The first step is a biometric screening. Screenings can be completed on-site, at your physician's office, or through an at-home kit. The screening will measure height, weight, and blood pressure. It will also require a small blood draw and measure your cholesterol, glucose, triglycerides, and other blood levels. The on-site screenings are free of charge, and you can schedule an appointment at a time that works best for you. This step must be completed in April or May each year. The second annual step is to complete an online health assessment questionnaire, which will ask you to self-report certain health conditions and habits. It includes the results of your biometric screening once it has been completed. This tool gives you a snapshot of your overall health on an annual basis and provides guidance on areas for improvement. This step must be completed between April 1st and May 31st each year. The third annual step is to enroll in one of the wellness programs by November 20th. Once enrolled, you must meet requirements by March 31st of the following year in order to successfully complete the program. This 3-step cycle repeats each year. The current wellness programs available can be found in the Options Guide located on the Benefits website. Program options and details may change between plan years. You enroll online at wellnessoptions.nebraska.gov or by calling 1-866 956-4285. You'll be able to learn more about each program by visiting the website. Another important component of your coverage is prescription medications. A prescription drug plan is included with all health insurance plans, and the cost for the coverage is included in your health insurance premiums. The prescription drug plan is offered through United Healthcare and is called Optum Rx. United Healthcare has an extensive network of over 64,000 pharmacies and also offers mail-order service for 180-day maintenance prescriptions. Your United Healthcare medical insurance card will also be used for prescriptions. The prescription drug plan has 3 tiers of coverage with different co-pays. Tier 1, generic medications, offers the lowest possible cost on your medications. Tier 2, preferred medications, covers brand-name drugs at a discounted rate. Tier 3, non-preferred medications, covers brand-name drugs that are not considered preferred medications. This has the highest copay expense. The prescription drug copays differ between the 4 health insurance plans. The Wellness Health Insurance Plan offers the lowest copays on your generic medications and lower copays on medications for certain health conditions, including diabetes, hypertension, and high cholesterol. The Consumer-Focused Health Plan requires the employee to pay the full cost of prescriptions until the annual plan year deductible is met. After that, you will pay 20% co-insurance for your prescriptions. The Consumer-Focused Health Plan also has a preventive drug list that is covered differently. Drugs listed on the preventive drug list have no copay or a low copay under the Consumer-Focused Health Plan. Vision insurance is managed by iMed and covers some costs for frames, lenses, contacts, and eye exams. You can select from a basic or a premium option. The basic option allows you to purchase new eyewear every 24 months with a copay. The premium option allows you to purchase new glasses or contacts once every 12 months with a copay. Both options give you and your family access to a routine vision exam every year with a $10 copay. Emeritus is our provider for dental insurance and offers 2 dental insurance options. The basic option only covers orthodontia up until the age of 19, and out-of-network services are covered at a reduced rate. The premium option includes adult orthodontia services and covers out-of-network services at a higher rate. Both plans offer coverage for preventive care services such as cleanings and x-rays, basic procedures such as fillings, and major procedures such as bridges. Both cover in-network services provided by an emeritus PPO dentist, as well as out-of-network services. If you choose not to enroll in dental coverage as a new hire, you can enroll during the annual open enrollment period. However, you are considered a late entrant and are limited to preventive services for the first 12 months of coverage. Emeritus also offers a dental rewards program that is explained on the LINK website under the Wellness and Benefits section. To save money on taxes, a flexible spending account or FSA is offered. Flexible spending accounts allow you to pay for medical expenses and dependent care expenses, such as daycare costs, on a pre-tax basis. The money you deposit into your FSA is deducted from each paycheck in equal amounts throughout the year before taxes are withheld, thus lowering your taxable income. You then file for reimbursement once you incur eligible expenses. There are 2 different types of FSA accounts available. The Dependent Care FSA may be used for eligible daycare, before and after school expenses for children under age 13, or for care for independent adults, such as elder care or care for disabled individuals. The Healthcare FSA is for eligible out-of-pocket medical expenses for you and your dependents, such as deductibles, co-pays, prescription drugs, etc. Please review the online plan summary to see the full range of eligible expenses. Once you determine what your eligible expenses are, you can create your estimate for how much you may spend on these expenses during the year. Estimate carefully, because if you do not use all of the money in your FSA account by June 30th, you lose the remaining balance. Long-term disability benefits offer financial protection when you are unable to work due to an illness or injury. 4 options are available to choose from based on the length of the qualifying period. The qualifying period is the length of time you must be off work due to your illness or injury before you begin collecting the monthly long-term disability payment. You may choose between a 2-month, 3-month, 6-month, or 9-month qualifying period. The benefit amount refers to the percentage of your current monthly income you receive as a benefit payment. All options pay at 60% of your current monthly income as your benefit payment. The premium cost is based on your age and salary. A calculation tool to determine your premium cost is available online. New hires may enroll in any of the 4 available options without providing evidence of good health. If you choose not to enroll as a new hire, you are required to submit medical evidence of good health before enrolling in the future. The state of Nebraska provides you with a $20,000 basic term life insurance policy at no cost as long as you are a full-time permanent employee. Part-time employees may choose to purchase this policy at minimal cost. You may also choose to purchase supplemental life insurance coverage in the amount of 1/2 of your annual salary, all the way up to 5 times your current annual salary. The cost for supplemental life insurance depends on your age and salary. The benefits website provides the rates so that you can calculate your premium cost. As a new employee, you may elect any of the 7 supplemental life insurance options without providing evidence of good health. You may also choose to purchase an accidental death and dismemberment policy at a rate of 10 cents per month. This policy pays benefits in the event of an accidental death or for serious injuries received as a result of an accident. You may choose to purchase dependent life insurance for your spouse and dependent children. A high option policy is available which provides a $10,000 life insurance benefit. A low option policy provides a $5,000 benefit. The premiums are a set amount regardless of the number of dependents you are covering. After the new hire enrollment period, changes may be made to your insurance benefits only in certain situations, such as family status changes. These include marriage, birth or adoption of a child turning 26 years of age, change in spouse's employment status such as a layoff, death of a spouse or dependent child, divorce or legal separation, or spouse's open enrollment. If any of these situations occur, you must submit the change online in Employee Work Center within 30 calendar days of the date of the qualifying status change. The appropriate documentation must also be attached for qualifying status changes. This may include a marriage license, birth certificate, divorce decree, etc. The effective date of the change depends on the situation and when the change request is submitted. The other situation allowing changes is during the State of Nebraska Open Enrollment event. Each spring, the state holds an open enrollment event, which allows you to make changes to your current insurance coverage. This could include dropping coverage you no longer want, adding coverage you don't currently have, or changing the type of plan in which you are enrolled. Open enrollment elections take effect on July 1st. Employees are required to complete open enrollment each year in order to enroll or re-enroll in insurance benefits, so please watch for emails and other communication about this annual event. Now that I have given you an overview of the insurance benefits available for you and your family, please visit the LINC website at linc.ne.gov to review the plans in depth. It is important that you take the time to research which insurance benefits will meet your needs. As a new hire, you must make your insurance decisions within your first 30 calendar days of employment in order to be eligible for coverage. Please talk with your Human Resources office about what steps you must take to complete your enrollment. Remember the other 2 videos to watch about the benefits of working at DHHS and how to get paid. Thank you for joining our team and welcome to DHHS.